just, I guess, moving forward with the expectation it's going to be quite some time until we receive any tax revenue. Questions about that? So in response to that, I mean, we continue to look for ways to reduce our costs. And our goal is to reduce our costs so that we can operate without a tax revenue. And what we've done to date, I'll just give you a rundown. Some of these are repeats, but there's 5 positions where we've had resignations and we haven't filled those jobs, and that's a monthly savings of $21,475. We talked a little bit about the resignation of Dr. Lawton. That's happened, and this payroll was the first payroll where he had no time on his that we were responsible for. The other thing which we did is we eliminated the night coverage in cardio. That happened last weekend. And as I guess you would expect, we had a couple of codes that night, but without the cardio people here, and I talked to the ER nurse, and her answer was, we got through it, the patient did well. So we'll continue to monitor that, but that's about $10,000 a month saving. That's a significant saving. It is a change in our in the way we do business, but we'll not have cardiopulmonary coverage from 9 p.m. till 7 a.m. We also are in the process of eliminating the ER registration clerk. That'll be another change. Right now we have an ER registration clerk from all night long, 24/7. We'll be eliminating that from midnight till 7 a.m. and that's not a big savings, but it's $2,800 a month. We've had a couple of employee reductions where we've laid a couple of employees off, and that's one of them was an HR clerk, and with that we eliminated that position, and Mina's taking over those responsibilities. So again, our philosophy is you do a good job, we're going to give you more work, and Mina's a good example of that. Also eliminated a nurse clerk position. And that was a total savings of $45.31 a month. We talked to you a little bit about the volunteer reductions by the admin staff and some of the department managers, and that's a savings of about $8,100 a month. Other things that I would like for you to, they're on our agenda a little bit. We hopefully you will approve those, and that would be the elimination of the employee matching contribution to our 403 retirement plan. We'll continue our retirement plan, and employees can still make contributions to that, but we'll not match that. In the past, I guess right until hopefully tomorrow, we'll if you contribute 6% of your salary, it'd be a 3% match. We're suggesting that we eliminate that, and that'll be a savings of $10,800 a month. It's a little more than you might think it would be, but it's a nice savings. We talked to our employees about that today. The other would be elimination of the health savings account, the HSA savings account. Now we make a contribution to that. If employees are in an HSA, we make a contribution of approximately $50 a month to that. Is that a month or pay period? A month. We're suggesting that we eliminate that, and it'd be a $45.50 savings a month. The other big change, which we just really got in the middle of today, and I guess finished up, is a change in our health insurance coverage. We've been with CHC, Community Hospital Corporation, with that. It's been a very nice plan, but it's been a pretty rich plan, as the terminology is for a plan which has a pretty nice benefits. The big deal there is that with CHC, we had to follow their guidelines. So we were paying 71% of an employee that had family coverage. We were paying 71% of that total premium. For an employee that had either employee and spouse, or employee and dependents, we were paying about 65 to 68% of that, and we were paying about 56% of those that had employee only. You know what we're moving to. is to where we'll pay 50% of the coverage. That, you know, we looked at, and actually one of the things that we seriously looked at was only paying the employee portion of that. But we felt like that it was too big a step from where we are right now today to move to just that. So we agreed that we'll pay 50% regardless of what coverage you have. We'll pay 50% of that, and that is a significant savings. I don't have that number identified, but it'll be the most significant saving that we have with any of these. It's and I recognize it's pushing that cost back to the employees, but I do think that it gets us more in line with the industry. Not just the healthcare industry, but the total industry. I think it gets us closer to in line with that. You know, employees will be picking up additional costs with that, but you know, we went through we've been registering, or I guess what's the term? Enrolling employees all day long today, and there's been very little pushback from the employees. They understand our situation. I think they really got it, and they recognize that as a result of that, you know, they're going to be expected to pick up some additional costs with that. So just with the elimination of the 403B and the health savings account, that's a monthly savings of $15,350. And this will be significantly greater than that. And, you know, whenever we get those numbers pinned down, we'll know what those are based on what coverage people accept. So I'll be able to provide it to you certainly at our next meeting. The other big, larger saving, I guess, is whenever our family practitioner leaves on 9/1, you know, that'll be a savings, another savings of about $23,000 a month. Add all those together. What's already in place, not counting the physician resignation in 9/1, that's $84,000 a month. When you add that number in, that's $107,606 a month, which annualizes 2.91. The insurance change will get us pretty close to where we want to be. You know, we want to be at about 1.7. Is where we're trying to get to. You know, somewhere in that range. So it's you know. We're doing from our perspective, we're doing the right things to get us where we need to be. And you already know that, you know, that about the pay, no pay increases and the no PTO buyback and those things. Questions about that? And this has been a very busy week for us. It's been from an operational standpoint. I mean, it's been a good week with the things that we've been able to accomplish. But it's been a very busy week. Donna has really been a busy week for her because much of this is HR related.
Ray, one question.
Yeah.
On the health plan. Mm-hmm. We're paying 50% of the HSA.
Well, it turns out that the PPO plan is less expensive than the HSA plan.
Wow.
And the enroller talked about that a little bit. And that, I think that's just the change in the industry. So we've said, okay, you can accept either plan that you want, but we were surprised. It was very odd. We were surprised with that. But she said that's kind of what's going on with the industry now with the HSA.
Okay.
The deductibles will increase. You know, we're looking at some ways, maybe through some discounted doctor visits or something to maybe provide some services that we can provide, or that particularly our employed physicians can provide that have no cost associated with it. We'll lose revenue, but there's no cost associated with that. Haven't made a decision about it. We've told people that we're looking at that. Maybe one visit at no cost, the next one at a discount, and the third one at maybe even a less than discount. Okay.
Okay, I believe you actually went into and discussed the items in item 8.
Yeah, I did. I did that sort of on purpose because I want to ask y'all to take some action on those that are scheduled to take place tomorrow. But I think it would be appropriate. Now let me talk about the CHC, the C item. We had an option, and there's an agenda item here, we'll address it when we get down there. We had an option to extend our coverage with Community Hospital Corporation for one more month. It would cost us $150,000 to do that, because that's about what our monthly premium is. We talked about it, we talked with our broker about it, and our final answer was we take that $150,000, we pay the current premium on the new plus some, and enjoy whatever that savings is, that $30,000 to $40,000 savings per month. So we just jumped in and did it, and got it accomplished. A lot of work by our employees and a lot of work by Ichabod, our broker, on that. So I'll ask you. I guess on the D, and I'll talk about this a little bit more. The three products that we'll be offering will be health insurance, dental insurance, and optional life insurance, where you can buy your own life insurance. We'll not be providing the things that are going away. Vision is going away, disability is going away. Most of these, are products that the employee paid for at 100% with vision, disability. We did provide life insurance at one time's annual salary, and we've eliminated that as part of our cost reduction. So if you want life insurance, you can buy it. It's for up to a certain amount. If you buy it, you have to take physical. You can guarantee. There you go. So those are the three products. Some of the other ones, we had some employees that had some of the optional insurances for critical illness. All those we're doing away with those. If employees want those, they can buy them from a broker. So we're getting pretty basic in terms of our benefits. Health insurance, which we participate in, dental insurance, which is paid for entirely by the employee, and life insurance, which is paid for entirely by the employee. So I guess I would like a motion to approve those changes in the employee benefits.
Yeah, under item 8, if anybody wants to discuss any of this that Ray's given us information on, asking for us to approve eliminating employer contribution to 403B retirement plan, eliminate employer contribution to health savings account, eliminate participation in CHD or Community Hospital Corporation benefit program, and then approve participation in health, dental, and life insurance programs through Ichabod. So if y'all want to take them all at once or one at a time, what's your pleasure?
I have a question about the contribution to the retirement plan. Is that something that's going to be permanent, or once we get in better financial shape, can we look at?
What we've told our employees on all of this is we're not making any promises, but when our financial situation changes, we'll come back and we'll take a look at what y'all would like to do. But we didn't make any promises that when we get the luminant money, we'll do this or we'll do that. We'll just say whenever our financial situation improves, we'll come back and we'll take a look at our entire benefit piece again. Very good question.
Any other questions from the board?
Make a motion that we approve number 8, eliminate employer contribution to 403B retirement plan, eliminate employer contribution to health savings account, eliminate participation in Community Hospital Corporation benefit program, and approve participation in health, dental, and life insurance programs through Ichabod.
Okay, you have a motion by Dwayne Griffin. Do I have a second?
I'll second.
Second by Pam Parsons. Any discussion, any further discussion?
I think that I would just like to say that it's with a lot of regret that I will support these changes. I think our biggest asset is the people who work here, and there's a lot of uncertainty for many of them. They know that they don't have a choice. They know that we don't have a choice. And it's important that we look at a way to, at some point, for lack of a better term, reward the loyalty of people who are putting their families at some risk by accepting these changes. Granted, they're still working and there's a benefit to having a job, but they're still here, and that's what's important to us. They're our biggest asset. When you talk to people who are being discharged from the hospital, they don't talk about the color on the wall, they talk about the people who took care of them. And we need to make sure we keep in mind a way to try to help reward these folks for the work they're doing with less reimbursement and less benefits.
Could not agree with you more.
And I want to say,